The long mahogany table stretched across the room, surrounded by towering bookshelves filled with medical ethics journals and past research decisions. The air was thick with anticipation as the UQueli University Research Ethics Committee, REC, convened for one of the most sensitive reviews of the year, a clinical trial protocol on analgesia in labor. Leading the review was Dr. Amara Okeke, a meticulous physician and renowned bioethics expert. Her name was synonymous with integrity. No flawed protocol escaped her scrutiny. Before her sat the trial proposal, a randomized controlled study investigating the safety and efficacy of a novel analgesic for pain relief in labor. Around the table sat committee members, a mix of clinicians, legal experts, social scientists, and community representatives. Each understood the weight of this decision. Labor pain relief was a delicate matter in Africa, where cultural beliefs, accessibility, and historical distrust of medical interventions shaped attitudes toward maternal care. The spirit, standard protocol items, recommendations for interventional trials checklist lay before Dr. Amara Okeke. She cleared her throat. This trial aims to test a new analgesic, Dr. Okeke began, scanning the protocol. But does it offer a significant advantage over existing options like epidurals or opioids? Without clear justification, this trial is unnecessary. The lead investigator argued, we hypothesize fewer side effects and improved maternal satisfaction. Dr. Okeke leaned in, eyes sharp. That needs stronger supporting data, participant safety and risk assessment. How do you mitigate adverse effects, she asked. Pain relief is crucial, but the drug's long-term impact on neonates must be assessed. A pediatric specialist spoke up. Neonatal respiratory depression is a concern. We need clear monitoring protocols for newborns. The community representative agreed. The trial must align with local maternity customs or it will fail. Dr. Okeke flipped to the data monitoring section. Who oversees ethical compliance? How do we ensure genuine informed consent? Dr. Okeke continued. Many women may feel pressured to participate due to limited pain relief options. The principal investigator admitted, we plan multiple rounds of counseling in local languages, ensuring autonomy in decision-making. Nods of approval, community engagement, and cultural sensitivity. The proposal lacks engagement with traditional birth attendants, who play a key role in maternal care, said Dr. Okeke. Without their trust, many women will refuse participation. The protocol outlined weekly independent reviews by a Data Safety Monitoring Board, DSMB. Adequate, she conceded. The ethics committee debated. The trial had scientific potential, but was the ethical foundation solid enough? A vote was called. Watch the second part of this story to see the vote and how the trial started and ended. You will be inspired. Good science saves lives.
Now that you have watched the animation, let's dissect it to pick out the good parts. 1. The committee was diverse in its membership. That is, the members were of different ages, genders, socio-cultural backgrounds, religion, and sensitivity to community attitudes, and you could see these in the approach to the protocol. According to Section D, page 13 of the National Code of Health Research Ethics, the Code E, subsection CS, I quote, the NHREC shall be sufficiently qualified through the experience, expertise, and diversity of its members, including consideration of age, gender, socio-cultural backgrounds, religion, and sensitivity to such issues as community attitudes, to promote respect for its advice and counsel in safeguarding the rights and welfare of research participants, including that of the researchers. 2. More so, members should have varying academic and professional backgrounds to promote complete and adequate review of the protocol. Another good practice from this story, which you should appreciate, is 1. The regular meeting of the NHRECs. NHRECs should be regular and consistent with their meeting schedules. Doing this helps both the NHREC reviewers and the researcher in planning their competing schedules and project timeline, respectively. 2. The compliance of the NHREC with the Code E. According to the Code E, Section E, subsection A and B, which deals with NHREC functions and operations. It states, and I quote, except when an expedited review procedure is used. Research proposals shall be considered at regularly convened ordinary meetings of NHREC, at which a majority of the members are present, including at least one member whose primary concerns are in non-scientific areas. Furthermore, in Part C, read, where a member cannot physically attend a meeting, the member shall be accounted as being present if she can participate electronically for most of the meeting time. From the earlier quoted sections of the code, you could pick something from the story. 1. Amaka was qualified, and that is in education, training, and experience to review that clinical trial protocol. 2. Amaka had access to the review packets. Reviewers should have all the protocol packets, reviewers' checklists, and any administrative or clinical information to make proper determination of the approvability of the protocol. 3. Dr. Amaka presented the protocol at the convened NHREC meeting. Protocols that qualify for main board meetings should be presented by the reviewers, either in person preferably or by teleconference. Reviewers should make out time to prepare for the presentation, as you can see here. Amaka was prepared. 4. Reviewers should have integrity and competence. Amaka is known for her integrity and competence. Young and experienced reviewers should learn from experienced ones, and the reviewers should be transparent, responsible, reliable, honest, trustworthy, and unbiased.
Now, depending on your HREC's review style, you should have gone through the protocol packets ahead of the meeting. It is good practice to go through all the review documents, even if you are not presenting at the meeting. There are good examples from this video. 1. The review was prepared and came to the meeting with questions. 2. The reviewer, although not shown, must have reviewed as the primary or the main reviewer. So she reviewed the entire protocol. You should review the entire protocol, including the science. 3. Thorough review involved following an established review standards, guidelines, ensuring that the criteria for approval, which should be available to all reviewers, are followed. 4. Clinical protocols required a clinician or an expert in the subject to review the protocol. A non-scientist could focus more on the consent documents, while the scientist focuses on everything. The chair and non-presenting members should review all documents and protocols ahead of the meeting. A good ethics committee has the following virtues. It is collaborative, supportive, positive, curious, teachable, reflexive, patient, open-minded, fair, thorough, transparent, and objective. In this first part of the video, you should see the following. 1. Dr. Amaka and her team invited the investigator for clarification. This is good if an information not readily available before the meeting might delay the decision-making process. Ideally, the reviewer should follow the SOP to get this information before the meeting date. It is good practice to be collaborative and supportive in your relationship with researchers. You are not anti-science or science police. 2. Inviting the researchers in keeping with the Nigerian COD. However, it must be necessary for it to happen. 3. The researcher was humble, patient, and open as well. It is an honor to be invited to such a meeting. It's a demonstration of collaboration, and both teams should look forward to such opportunities where necessary.
Hi, colleagues. You see, Ethics Committee has virtues like a good researcher. As we expect scientists to be good, the Ethics Committee where Dr. Amaka works should be good too. Let's wrap up with the following summary. But be sure to subscribe to this channel, like and share. So, the summary now. 1. This was a clinical trial protocol review in a registered research ethics committee in Nigeria. It is a Category B committee. 2. The committee was properly constituted, and it achieved quorum at all times during the meeting. the voting or consensus moments. 3. The reviewers asked relevant questions after a thorough review of the protocol and the consent documents. It was thorough. The science must make sense, otherwise, there's no ethics. So, every part was important, including the qualification of the investigator and the team. The CVs were also reviewed pre-board. 4. Lastly, the investigator was cooperative and positive. All queries and issues were honestly and openly addressed and clarified.